AM 1430 KRGI, 105.5 FM. Good morning. I'm Brian Gallagher. We have a guest in studio from Central District Health Department. Colette Evans is here to talk about something that we all need to be aware of: high blood pressure. This is important stuff, so we've got some key minutes and some key information coming up. She's even got her study glasses on to make sure that you understand how important this is. All right, it's all yours.
Good morning. Thank you for having me. I wanted to talk about blood pressure today because it's really kind of one of those hidden areas in your life that you don't think about that really can cause big problems for you. Usually if you go to the doctor, one of the first things that they do is they check your blood pressure to make sure that it's all right and that it's where it needs to be. So a good blood pressure should be about 130/80. If it starts to get higher than that, your doctor is probably going to have a conversation with you and make some recommendations on what you can try to do on your own to get your blood pressure numbers back under control. You'll always want to consult with your physician, particularly with this. We know that high blood pressure increases your risk of heart disease and stroke, which are the two leading causes of death for Americans. And this was an interesting fact that I found, just because we know how prevalent diabetes has become in our community, is 6 out of 10 people who have diabetes also have blood pressure. There's some ways that you can try to manage your blood pressure on your own: increase your exercise, decrease alcohol intake, don't smoke, have a healthy diet, make sure you're doing your blood pressure checks on your own if that's a concern. And then if you do all those things and you're consulting with your physician and find out that that's just not enough to get your blood pressure where it needs to be, they can prescribe some medications for you and really work with you on your nutrition and your physical activity to do what you can to get that blood pressure where it needs to be.
My understanding is that in our busy life and in the 21st century, we find ourselves constantly on the go. One of the culprits is lack of sleep.
Yep, you're absolutely right. Lack of sleep does take a hit with your blood pressure as well. It's really important to get a good quality 7 to 8, 7 to 9 hours of sleep every night to also try to help keep your blood pressure under control.
There are a lot of things that can affect it. Sometimes it's family history. Sometimes it might be a current condition. Ladies that are pregnant may see higher blood pressure, so there are a lot of warning signs, and that's where you need to visit with your health care provider. But you also have some information available. It's called Living Well with High Blood Pressure.
We have a program that was developed through Stanford University. It's an evidence-based program to help people manage their chronic condition on their own, and a spinoff of that is Living Well with High Blood Pressure. That's a 6-week course or class, and the class sessions are about 2 hours, 2.5 hours, depending on the class size. And that 2 hours goes by unbelievably fast. But taking that class helps people get tools in their tool belt, so to speak, to really understand what they can do on their own to manage their condition.
So high blood pressure can be a situation. It can lead to other health issues. Stay on top of it. It'll help to minimize the risks that you potentially could face. So do what you can to keep that under control. If folks have a question, can they reach out?
Absolutely. Please call us at 308-385-5175.
Colette Evans with all the good news from Central District Health Department. Thanks.
Thank you.
Good morning from AM 1430 KRGI 105.5 FM.